Good morning and welcome to Kusuma Husada Hospital. I'm glad to have you join us for your clinical practice.
Good morning, thank you so much for having me here. I am excited to learn and contribute as much as I can during my time here.
Great to hear. Before we begin, let me introduce myself. I am senior nurse Amanda and I'll be guiding you through your hospital experience. Shall we start with a tour around the hospital?
I am Indah, a nursing student. Absolutely, I am ready whenever you are.
Excellent. First, let's take a tour of hospital so you can get acquainted with our different departments and their functions. Here we have our emergency department, where we provide immediate medical attention to patients in critical condition.
Oh, it seems quite busy here.
Yes, it can get hectic, but we are well equipped to handle emergencies. Next, we have our intensive care unit or ICU, where patients with severe illness or injuries receive special care and monitoring.
I see. And what about the operating room?
That's where surgical procedures take place. We also have departments like medical surgical units, obstetric and gynecology or OBGYN, pediatrics, radiology, laboratory, pharmacy, and physical therapy. Oh, and don't forget about CSSD or Central Sterile Supply Department. Each department plays a crucial role in patients' care and treatment.
That's quite a comprehensive list. Could you please provide more detail about the function of the Central Sterile Supply Department or CSSD and Obstetric and Gynecology or OBGYN department? I am not very familiar with them.
Of course, this SSD is responsible for sterilizing and maintaining surgical instruments and equipment to ensure they're safe for use in procedures. The OBGYN department, on the other hand, specializes in providing care for pregnant women, including prenatal care, labor, delivery, and postpartum care, as well as addressing gynecological issues.
Thank you for clarifying that.
Now, let's talk about some of the machines and tools we use here.
I noticed various machines and tools around the hospital. Could you explain their function?
Certainly, we have ECG machines for monitoring heart activity, blood pressure, blood pressure, blood pressure monitors for measuring blood pressure level, pulse oximeters for monitoring oxygen saturation, patient monitors for checking vital signs, MRI machines for imaging internal structures, and many more.
What about the one over there?
That's a syringe pump. It delivers precise amount of medication or fluids to patient.
And what's the difference between a syringe pump and an infused pump?
While both pumps deliver fluid or medications, a syringe pump administers them using a syringe, usually for smaller volumes and more precise dosing, whereas an infusion pump delivers large volumes or fluids or medications from a reservoir or IV bag at a controlled rate.
Ah, I see. Thank you for clarifying that.
You're welcome. If you have any more questions or need further clarification during your rotation, don't hesitate to ask me or any other senior nurse here.
I appreciate that. Thank you so much for your guidance.
It's my pleasure. Now let's get started with your clinical rotation. I'm sure you'll learn a lot and gain valuable experience during your time here.